People across China are crowding into trains and buses as they travel home for the Chinese New Year. With the holiday rush at full tilt, authorities say the nation's COVID-19 outbreak has reached a peak. Infections, they maintain, are at, quote, a relatively low level, and they say the number of seriously ill patients is also on the decline. The World Health Organization has also praised China today for its quick progress on elderly vaccination, even as WHO data contradicts Beijing's claims that infections are in fact on the wane. A report shows hospitalizations in mid-January jumping to their highest ever. The number rose 70% to more than 63,000 from a week before. Our CNA's Lo Min joins us live from Shanghai. Min, is there any way to get a true picture of the outbreak in China? With all this travel, is the country prepared for another wave of infections?
Well, it's impossible to tell with these contradictory statistics, but we do know that Chinese state media has been taking a more reassuring tone recently, saying that Chinese New Year will not lead to a huge resurgence of cases. But the government did acknowledge a shortage of resources in rural areas because up until this January, we know many rural clinics did not have an oxygen tank or even oximeters which detect the level of oxygen in your body. But the government now says that they have distributed 1.2 million oximeters and over 100,000 ventilators to rural clinics and county hospitals. The problem, though, is that even with this hardware, some local healthcare workers may not know how to operate these machines because less than 1% of grassroots healthcare workers have a college education. Many received little medical training. And so China's top epidemiologists have actually urged doctors from urban cities to travel to rural areas as volunteers to help fight against COVID-19. He also encouraged migrants traveling home to bring back medicines and to encourage their relatives, their elderly relatives, to get vaccinated. But despite the government's reassurance, some overseas health experts say that we could see a, quote, COVID-19 tsunami. That's because rural areas have 50% higher proportion of elderly compared to urban cities. And as we know with COVID, age matters. Over 90% of those who died of COVID so far in China are above 65 years old.
All right, I wonder if that's putting any damper on the Chinese New Year mood. Behind you, we can see a great deal of hustle and bustle. How would you describe the mood there for Chinese New Year?
You know, I find it so difficult to describe living through this moment in China because this country has been so ravaged by COVID-19, but it's affected everybody so differently. Just yesterday, I was driving past a street and there was such a long queue, people queuing up for food, delicacies and gifts for Chinese New Year. That was such a surprising scene for me because the last time I saw such long queues, it was always for a PCR test. And so that scene was so surreal. It tells me that this city is recovering. This is what resilience looks like. And then when I go to the railway station, I see these migrant workers carrying huge gunny sacks. They are so excited to go home after so long away. But on the flip side, I speak to young people who tell me they're staying in Shanghai alone, celebrating Chinese New Year alone for the first time. They're not going back to their hometowns because they have elderly grandparents who have underlying health conditions who haven't got COVID. And they said they will never forgive themselves if they travel back home and pass this virus to their grandparents or even cause their deaths. And I also spoke to people who lost their loved ones to this pandemic. They're not celebrating Chinese New Year. They are mourning a loss. And they say they can't even accept gifts or condolences from relatives because they haven't been able to give a dignified farewell to the dead. Have a listen. 70-year-old Wang Fugang lost his mother unexpectedly to COVID-19 at the start of the new year. She died at the hospital, where her body still lies in the morgue. Mr. Wang is still waiting for authorities to inform him when the body would be cremated and when he could collect the ashes.
由市政府另行安排，可花的时间是你等通知90天，什么时候电话通知你，那么你就到什么地方去领骨灰。大礼仪这是没有了。
Mr. Wang says he finds it difficult to accept that he can't give his mother a proper send-off, but he found solace after realizing others experienced worse.
有的家属病床难久了以后，就死在家里了，已经甚至于差不多在多天了，都还没办法顺顺利利的把这个接到殡仪馆，把尸体接走。
Mr. Wang's mother is one of nearly 60,000 who died in hospitals during this latest COVID wave. For the first time since the pandemic began, China released a COVID death count that includes those dying from other underlying diseases besides respiratory failure. This after widespread criticism for its narrow definition of COVID deaths. But experts say the latest data still underrepresents the severity of the outbreak.
If you divided this 60,000 by the number of hospitals that treat those cases. So each week, there's average only one patient die. That seems to be not consistent with, the anecdotal evidence.
CNA visited and called several crematoriums and found that some places only offered a 10-minute send-off ceremony, others none at all. Many faced waiting times lasting months.
现在这里可以进行遗体告别仪式吗？
目前没有，是立即火化。
立即火化，所以家属不能办丧事是吗？
对，没有仪式，没有追悼仪式。
Funeral service was in such shortage that the government began cracking down on funeral scalpers who charged exorbitant prices during this dire straits. CNA understands that funeral agencies are no longer allowed to offer intermediary services. Customers can only liaise directly with mortuaries now to avoid overpaying.
I visited several shops selling funeral supplies, and some told me that business has gone up threefold and prices have doubled. Yet some say they're stuck with stock that they can't sell because people are not able to hold funerals. 鲜花也卖不掉，
卖不掉，谁呀？追悼会都不开卖什么鲜花？
原材料没有了，好多都没货了。你像这些盒子，你看到的都不一定有货的，很多都断货了。这一枪死的太多了，没办法。
The revised death count doesn't include those who died outside hospitals, like in elder care facilities or at home.
So when we talk about the countryside, right, where there's a lack of access to antigen tested kits, so it is very likely many of those patients died at home, without even getting tested for COVID.
Experts estimate that China could see over 1 million deaths this year. Over 90% of those who died so far are 65 years old and above. Authorities believe the peak is over in large cities like Beijing and Shanghai. But China is now bracing for another peak to hit the rural areas as Chinese New Year approaches, when millions of migrants head home. Lo Minmin, CNA, Shanghai.